saw you watching this time.
I didn't miss it. Yeah.
Good morning.
Good morning.
How are you?
Great yourself.
I'm good. I'm good. I'm good. I'm here. I feel like Steely. I'm here. Ah, yes, it's been a week. It's been a week. All
Yep.
right. How was your week?
It was good.
Good, good, good. Good morning, Renita. Happy Saturday. Happy Saturday. All right, all right, all right. Well, let's get this. My sound all right? My mic sounds nice. All right.
Everything
Look, I didn't even put the other mic on. I was like, forget it. We just gonna go with this get up.
great.
Okay, cool, cool, cool. All right, all right. So let us get this party started. We got a lot of stuff to spill, if you will. So welcome to the Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, personal strategies in this season, the revenue cycle at large, just all of the things, all of the things. And as you come in, don't forget to hit the thumbs up or like button. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And PRN is a healthcare compliance consultancy located in Cincinnati, Ohio. Yes, we're in the heart of it all. That specializes in revenue cycle and regulatory compliance education. Now, let me ask you, do you know what it takes to be a certified marketable medical coder? Do you? Do you really? Are you sure you know? Well, before I introduce my co-host, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right, all right. If you are interested in getting more information about the 5 steps to become a certified marketable medical coder, check out the video description for the link that was given, the bit.ly link. All right. Also, joining me today is my co-host, Mr. Jesse, the registered trademark. Put some respect on his name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philadelphia. I have been in healthcare. I've worked as a nurse for a very long time. In 2014, I transitioned away from the bedside into the world of HIM. During the pandemic in 2020, I created a company, the Coding Nurse LLC, where I help nurses and other healthcare professionals with clinical backgrounds transition, excuse me,
Bless you.
thank you, into the wonderful world of HIM.
I have a whole sneeze in the middle of the introduction. That's what happens when you go live, right? And how, outside of the sneezing, how is that working out for you?
It's moving along good. I am, believe it, like next week, I will be halfway through my course that started earlier this month. We only have like 4 more weeks left after
Oh
next week.
my God, time is flying when you having fun.
Yeah.
Having fun. I'm almost finished refreshing and dusting off the material for my course coming up in March. So yeah, look, next is phase is the whole packaging and marketing and all of the things. Yeah, all of the things. I probably need to put together something like this is how you do all of the things. That may be next. Let me help you if you in this space. Yes, sir.
Before we go on,
Yes, sir.
Crafty Coder, I put my email address in the chat. Email me your email address, and a cell phone number because I need contact with you. And all I'm going to say is the meeting after the meeting is going to be lit.
Woo! Lit, 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 lit. Oh, okay. And Crafty Coder, I know I owe you a phone call. I had a funeral yesterday. But we could talk after. Well, we could talk during the meeting after the meeting, whatever. Because other folks may need the information that I have to provide. So, yeah. So it's going to be extra lit. Lit, lit. All right. So remember that this is a conversation and you can join in and add to the conversation. Don't be shy. We bring topics, we bring information. And this one, I think, ooh, child. I think folks will have some things that they want to say. So your opinion matters and is welcomed here. Just remember, you can use the chat to interact with us, share with us, comment, make jokes, all of the things right here in the chat. And also, if you have a question, make sure you put the Q first so that we know it's actually a question for us and we don't miss it as we go through. So again, for today, for those who are joining us today or watching the replay, we are unveiling the healthcare turmoil, layoffs, financial struggles, and the AI impact, and what you need to do if you are personally impacted. Yes. All right. But first, we need to get into our church announcements. Okay. There has to be a better way to do this. I'm gonna have to learn.
We definitely gonna need some covering with today's topic.
Oh, child. Because it's another pandemic going on. There's epidemic out here. Yes. Okay. Turn the music down some. Okay. I think you can still hear me and the music. All right.
Yeah.
So today I wanted to wait, let me just say good morning, Crafty Coder, our on the street correspondent, who actually is bringing us, little did she know, who is bringing us our church announcement today. Yes, there's the usher finger and the hand clap. All right. Yes. I feel you. Okay. So our church announcement today, if you are a member of the AAPC, you should have received an email with an invitation for free 99, I believe, free 99 enrollment in a new AI in medical coding course. AI is striking again all over the place. It says the artificial intelligence in medical coding and billing, they put it together, y'all, on the AAP side. Scratching my head. Okay. We'll clutching my pearls. Where are my clutching my pearls? We'll provide medical professionals, coders, and billers with an understanding of AI applications in coding and billing procedures. You will learn how AI can improve efficiency, accuracy, and productivity in medical coding and billing practices by leveraging natural language processing, machine learning, and automation. To understand the significance of AI and transforming workflows in the current industry and the future trends and opportunities in AI for medical coding and billing. You will receive 4 CEUs upon successful course completion. The approved book is AI in Medical Coding and Billing, Revolutionizing the Healthcare Industry. It's included with the course. This is an online self-paced instruction course. It's a asynchronous course, so you don't meet. You do it at your own pace with online or on-demand training. There is a certification if you're interested. Your certification will be issued upon completion with a 70% passing score. This is an 8-week self-paced course. They said those who are experienced medical professionals, coders, and billers, professionals new to the healthcare industry, AAPC members looking to understand the integration and future trends of AI for medical professionals, coders, and billers should take this course. Again, you will be understanding AI and its processes and potential for medical coding and billing, identifying natural language processing and machine learning and improving AI, and understanding the significance of AI and transforming workflows in the industry. Let's see. Introduction. The course includes an introduction to AI in healthcare, natural language processing and medical coding, AI-driven continuous learning and adaptability, enhancing coding accuracy with AI applications in medical billing, ethical considerations and data privacy for AI in medical coding and billing, implementation and integration of AI in medical coding and billing workflows, future trends and opportunities in AI for medical coding and billing, and a final exam. Yeah, so AAPC is shooting a shot and offering a free enrollment for members. For non-members, it's $350. For members, for an AI in medical coding course. I don't know why they call it an AI in medical coding course, but then in the mix, say billers are also welcome. Mr. Jesse.
Hey, if you can't beat them, join them.
Right. Exactly. All right. Do you have any additional church announcements?
No, I'm just ready to jump in.
Okay, you just ready to jump in. All right. So again, thank you to the Crafty Coder, our on the street correspondent, for that, bringing that information to our attention and giving us something to share with you in our church announcements. All right, so let's get into it today. So, ooh, child, I don't know what you heard, but it seems like 2024 is coming in and rolling in with a bang. A bang, bang. Bang, 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 bang. And before we get into some of what's happening, and I also want to thank my co-host this week for providing us with our topics of discussion and information. So, a guest author in the I don't know who this artificial intelligence, health, wellness, and biotech Crunchbase News. Okay. Provided some diagnosing healthcare IT for predictions for 2024. Provided an article. Alex Mason and Justin Levine. So they wanted to talk a little bit about what's happening as it relates to healthcare IT, and from their perspective, there's a whole bunch of stuff that's happening. They said when the pandemic hit, the technology backbone supporting health systems strained under unprecedented demands. Healthcare IT companies were pushed into a new frontier, needing to facilitate a vastly different operating environment for their customers, dealing with surges in claims, billing, staffing, video appointments, vaccine scheduling, and many, many more dynamics. Well, now they're in a position to kind of leverage those innovations that came about as a result of the pandemic to help solve the industry's more intractable problems, as they put it. Amid shrinking profits, providers and health systems are grappling with staff burnout and a worsening talent crunch, according to their observations. Payers are contending with an ever more complex reimbursement landscape. Employers and consumers are facing rapidly escalating cost burdens. Healthcare is at a breaking point, but technology, in many cases enriched by AI, may finally be robust enough to provide workable solutions to what's ailing the sector. And here are the 4 predictions where the healthcare IT industry is headed this year. The first thing they say, AI will take some of the pain out of revenue cycle management. In 2024, they expect to see big improvements in the revenue cycle management software market. It said, and then they give you some information about what the revenue cycle is for those who may not know. And pretty much with AI, they are already seeing some massive improvements in the revenue cycle management systems, especially around coding and claims processing. With Waystar, I think we've talked a little bit about Waystar before, eyeing the public markets and fast growing companies like Fathom deploying AI to radically change facets of the revenue cycle, in its case, coding. We expect to see several revenue cycle management startups raise significant funds to scale this year. The health tech will blur the line between employers and insurers. I think this was about how the employer will try to keep the insurance costs down by providing or managing the entire insurance process through their companies. So that one. Value-based payments will get operationalized. Health insurers have been shifting toward value-based payments, going away from only collecting the fee-for-service payments, and they feel like they will see startups leverage AI to provide both payers and providers with tools to set and measure patient objectives and to be fairly compensated for positive outcomes. AI can analyze millions of patient records, diagnoses, treatment plans, and outcomes, comparing these data points against procedure costs to aid in the payment coordination between payers and providers. And startups could also emerge to manage the value-based revenue cycle, paying out agreed upon sums when patient milestones are met. I swear this sounds a little like risk adjustment, but that might just be me. Okay. And then AI assisted clinical decisioning will become the norm. So overworked doctors and nurses were already early adopters of AI, using it from everything from taking notes to image reading to diagnosis recommendations. And in 2024, they predict that they will see far more AI assisted applications enter the healthcare realm. So those were their predictions on AI and how it will impact some of us. Mr. Jesse, did you want to comment before I go on to what we're seeing out here in these early 2024 streets?
So what kind of prompted this whole discussion was I was sharing with Clarice that one of my former students who works in risk adjustment was laid off this week. So she has sent me a text asking me if I had heard that AI is going to take over coding jobs. So I wasn't going to respond in a text because that's a loaded question and I need a space to type. So I sent her an email and I was basically telling her because you have to be in, well, you and I have been in healthcare for a long time. Like I was around when they came out with HMOs. It was supposed to revolutionize
The
health.
world.
We see what it did. What people have to understand is every change is going to create new opportunity. It doesn't mean that everybody in medical coding is going to lose their job. It doesn't mean everybody in billing is going to lose their job. That is not what it means at all. What it means is that you will have a different type of job.
Mhm.
And if you are smart, you would be ahead of the curve and get a skill that you need. So when the shift happens, you'll be ready to be like, I can do that,
Mhm.
and just move on, pivot, and keep it moving.
Mhm. That's true. So again, we heard about all of these layoffs and the fierce healthcare at the end of last year. Dave, I'm about to butcher this name. Leo, wrote an article saying layoffs are ramping up among hospitals and health systems. And he gave 100 examples, all nice and alphabetized
Yes.
on all the different health system. And there's probably a couple more, but he limited it to 100. All the different health systems, all the different reasons why, how many, the numbers, all of the things. It's linked into the description box if you want to take a look. But he
Did he not?
huh
I said he did some research. Did he not?
Sir, he was the researcher of the year. Putting together all of the announcements and news reports and regulatory filings from all these hospitals and health systems that had occurred by the end of 2023. So again, if you pay attention to this is kind of setting the stage for some of the things that are actually happening now. Now we know health. There are a lot of health systems that are actually struggling, and it's 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 unfortunate because it's a whole bottom line issue. I tell people all the time, with some of these job losses and eliminations, that it's never personal. Oh, I need to get rid of the banner. It's never personal. Usually, it's never personal. It's about business. I used to, my friends used to joke and kid with me all the time because I would go into a position and go into a space and would have just enough things, personal effects, I guess, if you will, or items that will fit in my purse in the event I needed to walk out the door at any time. And I'd be like, well, why would you, ma'am, the way these things, the way healthcare has been set up over the decades, you never know. You never know. The one thing though that he mentioned and was mentioned in another the at the layoff.com, which was discussing the Optum and United Healthcare Group layoff that is real fresh, that just happened a few days ago. That they're laying off contract risk adjustment medical coders. They were laying off even frontline people, radiologists, radiology techs. The whole radiology department was let go. I know there's a trend in a lot of these organizations that are merging away from their home health. Some of them are merging away from skilled nursing facilities. So all of these types of organizations and operations may be something that is part of the future of some of these layoffs. In the Optum, and it's linked in the description as well. In the Optum, the layoff.com, it's just a whole thread about all the different the people. They said these jobs are being sent to India and the Philippines. The way in which they're laying the people off, though, again, just you come in, they seem to be blindsided. Now, a lot of these particular jobs, at least in the thread I'm going by, and a lot of these people were posting anonymously. Of course, you can gather that would be the case. We're saying that these were temp coders, and so a lot of the temp workers that they remote temp coders that they have employed over the last several months are now being, well, one, let go. And then you also have, I think, the group that said that they were quote unquote being furloughed. And so with the furlough, there's usually an opportunity for them to, in the event the need arises, and you are available to come back. But there were hundreds that were furloughed. It says you are all furloughed through April or longer. Please put in your time work today and log off immediately. I'm like, oh my God. That's wow. Mr. Jesse?
This whole outsourcing situation has been a thing since 2015.
Mm-hmm.
And I've said this a gazillion times. They can outsource to anywhere they want.
Mm-hmm.
Those people just don't have it. That's why it is important to, and actually, Tamara Denise, who I've never seen her, so welcome to our show.
Welcome.
Had put in the chat, like, what's a good skill to learn or add to your certification to pivot when AI starts to become more relevant and effective? So I responded, I think the most important, the best skill is auditing, because you're going to have to, and that's what I noticed when my job did outsourced in, I want to say 2015, 2016. Like, they laid off a whole bunch of people, a whole bunch of nurses who were coders, and went to the Philippines. And those of us that stayed, when we started looking at doing what they call overreads, you had to darn near recode the whole chart, because their skill level was just not there. Like, their knowledge of the guidelines was just not there. And risk adjustment is not going anywhere. It's only going to become bigger, but it is clear that the powers that be have decided that they're going to outsource the initial coding, and the only way that you're going to be able to make it is if you become an auditor and you're able to do re-reviews of not only risk adjustment, but any kind of frontline coding, regardless of the specialty.
Mm-hmm. Crafty Coder said, it's been my experience with HCC risk adjustment. It's a ramped up period, and then if your stats don't match, they lay you off.
Well, that I do agree with that, Crafty Coder. But what I always I don't advise anybody to work for these contracts, especially in risk adjustment, to work for these contract coding companies, because what was my experience is, you have people who don't know what they're doing. Like, if you ask them a question, you have to go through, because when you're a contractor, you have a company, but your company works for this company. It's too many people to go through to get a solid answer in a timely manner. And there's no real processes in place other than people just coding something, whether it's right or wrong. And then if you ask too many questions, or if you aren't able to process as many, and it might not be of any fault of your own, there's no remedy other than for them to get rid of you. And then people are left feeling bad, thinking that they have failed when it's the process has set you up to fail.
Exactly. Yeah. And then the last little article I'll bring up, and then let's talk some, we like to be solution oriented. So, and then let's talk about some solutions. Let's talk about some things that you can do. One, if this is personally impacting you, you may be one of the folks that were part of any of these types of layoffs or furloughs, or in the event your company is planning and you don't have a clue, you may get caught up in that. Okay. So the last one is Humana. Humana also plans to lay off a small portion of its workforce. They announced some limited workforce reductions. Again, several payers have, as we mentioned, have done some layoffs at the end of 2023, but it's still continuing on in the first weeks of 2024. So, yeah. So some of the things, getting rid of all this stuff. Okay. She said thank you. She will be purchasing the CPMA study guide very soon to get prepared for the future moving forward, because these bills don't care about no age. Ma'am. Exactly. Exactly.
Good job, Tamara. Because
Good job.
Before you move on, Clarice.
You go ahead. You take the reins, sir.
Tamara, I have my CPMA, and I have to honestly tell you, out of all of the certifications I have, that is one of the ones that made the most difference in me moving forward. So it'll be worth your time and effort, in my opinion.
She said it's about production with these companies and layoffs. It's crazy. Yeah. So, Mr. Jesse, did you want to start the conversation around that pivot? What
Yeah.
What should folks be thinking about? What should folks be doing as it relates to, if you're in that situation or maybe faced, or even if you thinking like, this may, let me be proactive in anything that happens.
This is it's old school, but it is so true. If you stay ready, you don't have to get
ready. Yes, that's the quote.
So I'm going to start with, make sure you keep your resume updated. That's number one. And no. That's going to be number two. Number one, make sure you have a decent resume. I have not read anybody's resume initially that is up to snuff. Like, there are too many. The game has changed so much. Like, there are applicant tracking software you have to get by. There's all kind of keywords you have to have in your resume just to even make it through all these systems. And you really need to make the investment. It is not just slapping some stuff up there and then submitting it. You have to have key information on your resume to move forward nowadays. And I say make the investment to get your resume professionally redone. It was one of the best things I did like 3 years ago, 4 years ago. And it has made all the difference. So that's first and foremost, is to make sure that you have your resume and your resume redone. And I stay looking for jobs.
Before you move, can I add to that?
Yes.
So one thing that you need to do, and sometimes it's hard to kind of think about, oh, well, what did I do? Whatever. But keep a running list of all of the things that you accomplished in your job. Keep a running list of the tab, because your job description may say one thing, but you may be doing other things. You may be on other projects. There are other things that may not necessarily be in your job description that you may forget. So keep a little journal. You know, everybody loves to journal. Keep a little journal of the things that you've actually accomplished. If there are, and one thing that folks love to see are the numbers. So keep a little journal. Hey, if you made an impact in any way on the reduction of something or the increase of something, keep those numbers as well, as you know, just because we can't remember everything, so just jot things down as it come, and that way that will help you refresh your resume. If some folks like to go in and refresh their resume on a monthly basis. I'm not going to say I do all of that, but you keep the journal, and that way when you, what you say, stay ready so you don't have to get ready. So you're preparing yourself, so when the time comes that even if you reach out to a professional resume writer, you got the content, you got the stuff right here, of showing actually what you've done. My 2 cents. Go ahead.
Great. I agree. And I stay looking for jobs. Like, I have been at my job right now for a little over a year. I stay on Indeed. I stay on LinkedIn. Because you always have to keep your ear to the ground. Tomorrow, I'm not guaranteed that I'm going to be there on Monday. They might be like, "Oh, you got to go." You have to know what's out there. And I think that for a long time, I think that people get too comfortable on these jobs, and then you have to process the emotional separation. When I'm not tied to no job, none. I'm tied to my direct deposit every other Friday, and when I get a whiff of something that ain't right, I'm indeeding it up. I'm LinkedIn it up. Um, I'm in people's. I'm
Hey, what's happening over? What's going on with you? What you doing? And
no.
now we have whole new opportunities coming. But I'll stay. Go ahead. You finish
Yeah.
your list.
Oh, other opportunities that's for the meeting after the meeting.
That's what meeting after the meeting. So if you are interested in the meeting after the meeting, check out the link. Our Patreon is there. You can feel free to join and partner us because it goes down in there. But go ahead. I'm sorry.
And you don't even even if you don't want to, well, I have all kind of alerts. So when jobs come up, I get emailed. You don't have to scour these job sites every day. When you register or sign up on a job site, or even at an insurance company, go put in an alert so you can be contacted for whatever type of position you're looking for. Then if something comes along, you'll be like, oh. And then also when you see a position, look at what's required and make sure that you have that information on your resume. It's about moving forward, not staying where you are. So you want to make sure that you have all your relevant skills documented, like Clarice and I talked about earlier, and you just want to make sure that you see what's available. You have to stay ahead of. You have to be able to spot trends, especially nowadays, because we have a herd mentality, and people all want to do the same thing at the same time. But if you get ahead while they around there scrambling, you can be in doing what you got to do. Learning new skills to stay ahead of them.
And we gave you one of those direct ways to stay ahead with our church announcement and this free AAPC course about AI. The other thing is, think about non-traditional places that need your skill. Jump on the AI bandwagon. These companies need people like us to help them understand our industry. They are tech people, they are IT people. They're not healthcare people. They're not revenue cycle people. So they need us to help push their agenda. Y'all see all these companies sprouting up. They throwing all these names out there. Go to their websites. Check out look at their LinkedIn pages. Go to their, information. See what they're looking for. Because they're looking for you as well. Now, I don't know what all that may look like, whatever, but hit that link if you need to, because they're looking for the expertise that we bring to the table to help them advance in their AI endeavors. Another 2 cents.
What's today? Saturday, Thursday. I just talked to my tutor. I've been last year. It was all about me learning SQL. Then I learned Python. So he and I still meet. So now he's trying to get his entrepreneur thing on, And I told him he's a data scientist and he works in fintech. He told me that he reached out to you.
Yes, we gonna connect next week.
I I I have been telling him, and I think now he's beginning to see it. I told him, I said, listen, that's what you don't understand. I said, with your IT background, if you apply this to the healthcare space, and if you yourself learn a little bit about the revenue cycle, you could be filthy rich because it's only tech and health. Well, that's why they call it health IT. It
Health
is
IT. It's a whole thing,
it
whole
is
industry.
going to get bigger, and if you get in on the ground floor and you set yourself up as the go-to, man, please. That's why I'm learning SQL and Python.
This one right here, I love it. I absolutely love it. Because again, this allows you to showcase and write your ticket into these organizations because you have a niche. You have something that nobody else offers. You're not just your typical certified coder. You're your certified marketable medical coder. You're bringing something else to the table. You are bringing additional skills that others may not even recognize or know that they even possess or even possess at all. Because it's like, oh, I just want to get in, or I just want to do what everybody else is doing, or sometimes you got to stand away from the crowd. Sometimes you got to be you got to have some forethought, and this will help in your auditing skills because that's typically what auditors do. They are looking to see, well, what is coming down the pike? They're looking to see, okay, well, this is what we need to compare the information to. Let me make sure that I'm on top of what they're comparing the information to. You need to be well versed in being able to understand regulations, being able to understand the stuff that they clearly give you to determine whether or not things are reimbursable. So that gives you some foresight. So you're not just saying, you are not just taking quote unquote a tool that somebody says, well, match this, match this. No, I always tell y'all, know the reason why. That gives you a step ahead by knowing the reason why. Oh, okay, I understand. This is why we seem to do whatever. For whatever reason, folks are not doing it. But I can spot a mile a minute what's wrong with this case based on knowing the reason why. So you just have to have some forethought in that and being able to, again, at a bare minimum, understand and know your guidelines. At a bare minimum. That's low lying fruit. That's easy to spot, knowing those guidelines. But then take it a step further because those guidelines were oftentimes created based on a regulation. So it's a hierarchy. You just got to follow that trail and master that trail.
Period.
Root cause analysis. Yes. Exactly.
And I also wanted to throw in there, like, especially like since you're having, because basically like what I'm noticing for the first time, even in coding period, is you're starting to hear way more often this whole revenue cycle management. Like
Yes.
people never really talked about it in those terms years ago, or even a couple years ago. Now you hear it all the time. And that's another hint to coders who want to be certified marketable medical coders, because I talked about SQL and Python. You don't have to start with that, because just like I told Hassan, that's my tutor. I told him, I said, the level of tech that you have is way above healthcare. I said healthcare is not that, even though there's a lot of technology involved, it's not advanced in terms of what they're doing in business. So I told him, I said, so you are already above the fray. But what I realized is I was so busy focusing on Excel. I mean, not Excel. I was so busy focusing on SQL and Python that I totally overlooked Excel. That's how basic healthcare is. They are
Everything is in a spreadsheet.
everything.
Everything.
If you just get to the intermediate level of Microsoft Excel as a coder, you could do some damage. in the revenue cycle.
That's right. That's
Because
right. So again, this is building your skills. So
exactly.
I know the first thing folks want to do is, oh, let me go get XYZ coding certification. Oh, let me go. Sometimes it's not even about that. Sometimes it's not. You already got what you need. You come into this table with your coding certification. You don't give them more money and you more headache because now you got more CEUs that you got to be corralling around. Sometimes it's just the basic. Let me further understand how my role and how I can help an organization. I can help an organization with the skills that I already bring to the table as far as my certifications with medical coding or anything in health information, but then I can also help them with this additional skill of my knowledge of Excel and how I can use that knowledge to do what is also the buzzword, data analysis. That's going to be your other friend, data analysis. Being able to take the information and analyze it and put it together in a form that is user friendly and provides information that folks need that will help them in the future is going to be also another golden ticket that you can use.
Because also getting back to that whole data analysis point, people who aren't coders and who just have no idea about coding, period, they look at numbers and they're like, well, how come this number can't be like this? Or how come this? That's where you as a coder come in, because it all comes in, because it all comes down to, for compliance, certain things have to be certain ways. So a number can only be what a number is going to be because of compliance. And that's what they have to understand. So this is like that's why we always talk about it all the time. It's not how much money you earn, it's how much money you keep.
Yes.
And if you do not, if your analysis is based off of some numbers that aren't compliant, it's going to throw it off. And that's the part that they're missing. I'm telling you, I see it just as plain as the nose on my face. Like, there is not enough people who know coding and know regulatory guidance that are in health IT to explain to these stakeholders why things can be the way it's not all about money. There's a way to get the money, but you got to do it this way.
Yes. And build the framework around that. And so the IT people may have the technical knowledge of the specifications on how to build that, but they don't have what it is they need to build. They don't have the understanding of the intricacies of healthcare revenue cycle to be able to build that framework. So they hungry, they waiting. Will somebody tell me? And you're the person to be able to tell them all day, every day. I was going to say something. I had a conversation just yesterday, to your point with, we were talking about something totally different, but she may know some people who may be potential clients. But when these physicians or providers, I won't beat up on physicians today, but these providers are looking to be acquired by other providers or other systems or what have you, one of the first things that they look for is the revenue and at the individual provider level. So what type of revenue is this individual provider generating for this organization? And oftentimes it's on the front end. So they'll say, oh, well, this provider submitted X amount of number RVUs. We're receiving RVUs that look like this. Based on their billing, this is the amount of money that they're putting out. Again, the revenue cycle has a whole other component to it because, they may be churning out and seeing or whatever, but again, what are they actually getting and what are they keeping? So one of the services that I actually provide is for clients who are in acquisition mode is that due diligence piece. You're going by what they're saying, but you don't really believe or you want to validate. Let's say that you want to validate that what they're saying is true. So that's where a chart review or an audit or a claims review or a complete review of the documentation to determine, okay, yeah, this may be what they're billing. However, their documentation doesn't support it. So somewhere down the line, they probably didn't even get that. Or the possibility exists that because this person, their documentation doesn't support either these billing codes or the medical necessary reason for this service, they may be a problem on the back end. So training may be, or some education and training may be necessary. Just being mindful of these numbers are not going to ever mix, and then taking a look and making sure that you have that back end revenue cycle process of managing the information that's coming in. So denials. Who's looking at their denials? Because that's an easy fix. If y'all go back and check and look and see, well, what's being denied. If this person is submitting all this stuff and none of this is matching up, then that means some things have been denied. Have y'all had that conversation? So it's a cycle for a reason. You got to connect the dots to keep the cycle going. And so you coming in, having that knowledge and knowing what your part is, but understanding that there's a back part to it as well. This is how you can help a organization who may be trying to acquire, or you can help strengthen an organization who may be trying to get acquired by somebody else. Because, hey, this is what you need to make sure that all your ducks in a row looks like, so that you look good on paper for somebody who may be wanting to come in and acquire your organization. So it's a win-win in the whole compliance, auditing, due diligence space. My 2 cents. I just gave a whole bunch of game right there, but go ahead.
Agree.
Ooh, so yeah, these are some of the things that you can do. I think we talked about, so in my research early this morning on this, there was a thread on Facebook who they were interested in understanding. Again, I think to me, it seemed a little short-sighted, but those are other folks' sites, wanting to know, oh, well, what was the certification of the people who were getting laid off? Were they CPCs? Were they CCSs? Blah, 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 blah. Who the hell cares? What was the skill set of the people? And unfortunately, and I think a lot of folks, I think only a couple of people kind of responded to, because they actually put a whole survey out, responded to the survey, but then they let them know it was based on the department of the folks. So again, it was, like we discussed, the risk adjustment piece. So again, that's a whole other thing. And to your point, risk adjustment is going to be here to stay, whether you're the risk adjustment coder or you're the risk adjustment auditor. It's still going to be here. It's just about the vantage point of what needs to happen. That was RT. Mm-hmm.
Exactly. I mean, and the most important thing that I want everybody to take away from this is, don't be afraid of AI. It's not because what people forget, the most amazing machine ever built or ever created was the human brain. Man didn't do that. So there is nothing man can create that can top that. We will always have a leg up on anything that anybody creates. All you have to do is just know how to take what is created and use it to your advantage. That's it. Don't ever be afraid of advancement, because it's just, that is a function of time. Things are going to advance. You just want to stay certified, marketable, and as a medical coder. So you have to pay attention to trends. You have to pay attention to shifts in the industry, and AI is that shift. But don't panic. And at the end of the day, it's just like Clarice said, get your skills up. Because if you know the guidelines and you really sure enough know your stuff, you will always be employed.
That's right. Or otherwise. Meeting after the meeting conversation. Yes. So yes. This was, and don't forget, and you talked a little bit about it, Mr. Jesse, going out to LinkedIn and all the other places, but don't forget to reach out to your network, the people that you know. I've said this several times. The majority of the positions that I've ever held were because somebody said, "Hey, I know somebody who needs what you do," or "Hey, I know somebody that is looking for XYZ. Is this something you could do?" or whatever. And then we start those conversations and we make those introductions, and voila, I may or may not be working for XYZ position. But it was all about the networking and the people that you know. So stay connected to the people that you know. And just if folks know that something is going on, or in this case, say the whole Optum situation, you may know some people that are at Optum, but hey, if you know that there's a job, reach out. Hey, I hear that so and so, were you part of the layoff? Are you okay? If not, here's some places that you may want to consider. They're hiring, because there's still people hiring. There's still people hiring for other things. But you can't know everything all the time. So help your fellow people out. Let them know. Reach out to them. Give them a, because it can be emotional. Like we all said, we used to them every 2 week direct deposits. So in my case, the monthly direct deposits, we used to them. So, it's a whole struggle. But then again, don't take it personally. Don't take it personal. It's a punch. It knocked you down. But shake. See, I was about to cuss. Shake that off. Shake it off. And get up and be ready to reach out and start the day. But with some of the things that we've mentioned today, it keeps you prepared. So again, I love stay ready so you don't have to get ready. Go ahead.
When you were talking about shake, you get ready to cuss. I was going somewhere else. I thought you was going to say shake the devil off, and you done let the devil use you almost.
Almost used me because I was straight back. It was right there on the tip of my tongue. Like, wait, no, we're not going to do that. Yes. Wait a minute. Network to get work. Absolutely.
And speaking of that, can I tell you that is the most underrated activity, because I never used to do it. And can I tell you, my first CDI job was because of somebody I know who bigged me up to her boss.
Mm-hmm.
And then one of my students, because if you take my course and you don't get certified, I don't recommend you for nothing, because you ain't doing what you're supposed to be doing. But I had a student who did very well in both CM and PCS. She got her CIC. In December, my job said that they were looking for people. I recommended her. Long story short, she starts Tuesday.
Yes. Love it. And that's how we have to do. Again, I feel like we're here every week. We're a resource. I feel like we have become a go-to resource, whether we see it in real time or not. I just feel in my spirit and know in my spirit that was what we were meant to do. And in saying that, I feel like I have an obligation to let folks know. I have an obligation to keep all of y'all in the know, because we have so much going on. Our lives are full. We have, family and other activities and all of the things. And so you can't do all of the things. But if I can in some way, or we actually, Mr. Jesse as well, and the crafty coder, our on the street correspondent, if we in some way can give you a little tea that helps you say, wait a minute, gives you some food for thought, some tea to sip. Well, wait a minute. I never thought about it that way. That will make your lives easier. That will help you in your career trajectory. That will help you as Miss Renita said, pivot to whatever may come your way in this year, the next, or whenever, that helps keep you ready so you don't have to get ready, then I feel like our jobs here are done every week, which is I'm adamant that I try to make sure that we have this every single week, because all of the things that we provide has some value for you in this health information profession. All of it, believe it or not. Even some of the stuff that we talk about, and you'd be like, well, how in the world is connected? Trust and believe. There is a connection one way or the other.
And this is also why I get up every Saturday. And this is why I always tell you, I give you major props, Clarice, for creating this platform, because there are a lot of people out there talking about the same things we're talking about, but it's so fluffy. It's not really anything actionable. Like, from the time we have started, we have been giving people game.
Game on game on game.
And I'm not going to be a part of no foolishness. I don't need to get up at 8 o'clock in the morning to get ready for 9 o'clock to talk. We want to do, as they say now, big business.
Big business.
I'm not.
Exactly.
If you have listened and you continue to listen to us, you will be set up. And if you don't, hey, you can watch us floss.
Wait, well, with that, so we're going to prepare for the meeting after the meeting. Again, for those of you who are Patreon supporters, feel free to check out the link in the description for Patreon, and come be a part. We have a whole other hour or so of additional content that we provide every Saturday morning, at usually about 10:15. So with that, I hope that you have gotten some tea and that the tea was spilled today. And thank you so much for joining us, or even checking out the replay. This was all good. I feel like that for me, actually, I learned something today. This was information that was valuable for me. So if it was also valuable for you, make sure you share the video, subscribe to the channel. Be sure to follow us for more information on all things health information, compliance, revenue cycle, medical coding, all of the things in the revenue cycle management. And as you leave, don't forget to hit the thumbs up or like button. And then also check out the Coding Nurse channel on YouTube and follow him on Instagram. He throws all kinds of stuff out there on Instagram. That's my nemesis. I need to get on Instagram more often. Be like, oh my God, whatever. But that's where the folks are. So I guess I got to be where the folks are. Anyway, so check him out there as well. This has been a great session today. Thank you all. Thank you all for joining. And Mr. Jesse, do you have any final words before I go?
No, just
okay.
Stay ready so you don't have to get ready.
Oh, love it. That's it. So this has been a great session today. Thank you all for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care.
Bye-bye.
Bye-bye.